Hey, everybody, welcome. Thank you so much for tuning in. If you're watching me on my YouTube channel or if you're listening through the podcast, Nutrition Reveals, I just want to say hi. Thanks for tuning in. Today's super special because I am officially entering into my 10th year of practice and ownership of the two combined clinics of Nutrition Health and Wellness and AZ Dance Medicine Specialists. I just want to take a moment to say just thank you to all the clients, all the educators, all the clinicians who I've worked with over the years who are just as passionate as I am about natural solutions to improving performance, whether that's on stage, on a field, around the house, whatever it is that um, you're personally endeavoring to improve on. Just, yeah, thanks for being there and being a part of that mission and that growth. I personally like to have a good and firm foundation for just about anything, but particularly for things that I do for the clinic, for my clients, and for the community. So, starting off season 2, episode 1 of both the YouTube channel and the podcast, I just wanted to do a recap of how Renutrition got started because it developed out of AZ Dance Medicine Specialist, and just a recap of what my personal mission is, what my hope and my dream is for everyone who I connect with within the clinic, within any type of educational community that I meet you in. So, if you don't know, hi, I'm Dr. Alexis Sams. I'm a holistic physical therapist, functional medicine specialist, and food pain expert. And Renutrition Health and Wellness was born out of AZ Dance Medicine Specialist through the COVID pandemic. So around end of 2019 and the beginning of 2020, most of you know that non-essential businesses were shut down. So dance, fitness, studios, programs, things like that were all put on hold. And so there were a lot of clients that I wasn't able to work with in that capacity. However, a lot of people knew about my functional medicine background. So I still got a lot of contact, a lot of people reaching out to me for guidance and information on improving their immune health, boosting their immune health, decreasing their risk of getting sick given, the climate and things that were going on at the time. And that's essentially how Nutrition Health and Wellness got started. It gave me the opportunity to work with um, clients outside of the performing community who were still having difficulty in overcoming chronic pain, other chronic symptoms, swelling, inflammation, things like that, and managing chronic diseases. So that's a super long story short, but that's basically how Nutrition Health and Wellness got started. Now, the name, people always want to know about the name, and I love when people kind of look at it and they're like, Rena, what is that? So, Renutrition is a combination of the words Renaissance and nutrition. I just put them together. And the reason that I did that is because my motto is giving a rebirth to natural healthcare solutions. Super short history lesson. The Renaissance period in Europe was all about kind of like a rebirth of how they thought about all things artistic, visual art, sculpture, architecture, things like that. So that's what inspired the name Renutrition Health and Wellness. Out of that, yes, I am 100% passionate about natural healthcare solutions, avoiding surgeries, injections, prescription medications to manage illnesses and diseases, but also to resolve symptoms that can be a little stubborn along the way, where people struggle to just feel their best and perform their best on a day to day basis. So that's my personal mission, bringing that rebirth to those natural solutions for taking care of yourself. And my philosophy, which I personally like, my philosophy I have coined or I have termed common sense healthcare. And the reason that I call it that is because I personally believe that if you don't understand what's going on in your body, you may not be in the best position to make the best decision in terms of your health and well being. So, my personal mission in terms of education is to make things really easy to understand, really approachable, provide resources that explain different types of reactions in the body, the basic purposes of our body systems, and things like that, just so people can be more aware of what's going on inside of themselves. And like I said, be able to make more informed decisions with their healthcare teams, with their providers, putting the client and the patient back in the driver's seat of their own health and not quite so reliant on their healthcare team to make their final decisions. I know even before I started my personal training journey in functional medicine, I was just, a regular patient just like everybody else. And I remember um, me personally, my biggest struggle in the past was with irritable bowel syndrome. So, abdominal symptoms that would never resolve, always having a prescription of oxycodone on standby or Zofran for my nausea, and just being so reliant on those as just kind of the only solution. And yes, I did get to a point where I thought that that was just going to be my life. I would always just have to have those on standby because at that time, my symptoms were not linked to any food or beverage or thing that I did or didn't do. It seemed so sporadic. And I do remember a sense of at that time, not even knowing where to start to know what was going on inside my body to be able to make any type of decision regarding, yes, maybe I'd like to look into this test or look, go down this avenue and try this, and maybe not necessarily look down that road in terms of figuring out what was going on. I was very, very reliant on my medical team, on my doctors, on my specialists to know what was going on. So I don't want other people to feel like that. I want other people to, since I've gained more knowledge, I want to pass that on. I want people to know more about what's going on inside of them so they can make better decisions. And I want to do that in a very easy and digestible, approachable way. So, common sense healthcare is what I've called it. And that's going to be my mission moving forward. I'm really passionate about working with those clients, even though I've worked with a ton of different people, different ages, different diagnoses, different symptoms. They're all different. The one thing that they have in common is not having an answer for what's going on. And that's what I want to give. I want to give answers, and then those answers turn into a more effective and efficient treatment plan and healing journey so that they get the relief that they're actually, or that they have been searching for so long. And they also come away feeling more empowered to be able to make better decisions moving forward as they continue to live their lives and come into contact with certain things or events that their bodies may react to. They just feel better about knowing what to do about it. So, if it's you or someone you know who has feel like they've had every test and spoken to every specialist and that they're still kind of having a challenge trying to figure out how to manage illness or disease, or how to resolve a symptom, how to reduce or even get rid of a symptom, those are my kind of people. Those are the people that I love to work with to help along. So as I enter into this 10th year of business, the second season of video and podcast, I hope you guys all continue to join me. I'm here for you. If you need me for anything, you guys know how to get a hold of me. And yeah, like I said, I look forward to many more years of helping and educating all of you guys. Thanks for tuning in. Be happy and healthy.